Welcome. In this video, we'll be exploring thoracic outlet syndrome, or TOS. This condition affects the space between your collarbone and your first rib, potentially impacting nerves and blood vessels. We'll delve into the causes, symptoms, diagnosis, treatment, and more, providing you with a comprehensive overview of this often misunderstood syndrome. So, what causes thoracic outlet syndrome? The primary issue is compression in the thoracic outlet, the space I mentioned earlier. This compression can arise from a variety of factors. Anatomical abnormalities, like an extra rib, are one possibility. Poor posture, especially slumped shoulders, can narrow the space. Physical trauma such as a car accident can also trigger TOS. Repetitive arm movements, common in certain occupations or sports, can contribute to the problem, and in some cases, the cause remains unknown, termed idiopathic to us. Let's break down the pathophysiology. The thoracic outlet contains vital structures: the brachial plexus, a network of nerves supplying the arm and hand, and the subclavian artery and vein, responsible for blood flow. Compression in this area can lead to nerve irritation or damage, causing neurological symptoms. It can also impede blood flow, resulting in vascular issues. Nerve compression often manifests as pain, tingling, and numbness. Vascular compression can lead to arm fatigue, swelling, and discoloration. The specific symptoms experienced depend on which structures are affected and the severity of the compression. Thoracic outlet syndrome affects a significant portion of the population, although precise numbers are difficult to pinpoint due to diagnostic challenges. Some studies suggest that it's more common in women than in men. Certain professions and activities put individuals at higher risk, including athletes, manual laborers, and those who spend prolonged periods typing or working at a computer. Age also plays a role, with TOS often appearing in young adults and middle-aged individuals. The signs and symptoms of thoracic outlet syndrome can vary widely depending on the structures involved. Neurological TOS often presents with pain, numbness, tingling, and weakness in the arm, hand, and fingers. These symptoms can worsen with arm elevation or overhead activities. Vascular TOS, on the other hand, may cause arm swelling, discoloration, a feeling of heaviness or fatigue in the arm, and even coldness or pain in the fingers and hand. In some cases, individuals may experience both neurological and vascular symptoms. Diagnosing thoracic outlet syndrome can be challenging, as the symptoms can mimic other conditions. The diagnostic process typically involves a thorough physical examination, including specific maneuvers designed to provoke symptoms. Imaging studies, such as X-rays, MRI, or CT scans, may be used to rule out other causes and assess the anatomy of the thoracic outlet. Nerve conduction studies can help evaluate nerve function, and vascular studies, like ultrasound or angiography, can assess blood flow. The diagnosis is often based on a combination of clinical findings and test results. Thoracic outlet syndrome is often categorized into three main types: neurogenic, venous, and arterial. Neurogenic TOS, the most common type, involves compression of the brachial plexus. Venous TOS involves compression of the subclavian vein, and arterial TOS involves compression of the subclavian artery. Each type has distinct symptoms and treatment approaches. Treatment for thoracic outlet syndrome aims to relieve compression, reduce pain, and improve function. Conservative management is often the first line of treatment. This includes physical therapy to improve posture, strengthen muscles, and increase range of motion. Pain management strategies, such as medications and nerve blocks, may also be used. In cases where conservative treatment fails, surgery may be considered to decompress the thoracic outlet. Surgical options include removing the first rib, releasing muscles, or repairing blood vessels. The specific surgical approach depends on the underlying cause and the affected structures. While not always preventable, certain measures can reduce the risk of developing thoracic outlet syndrome. Maintaining good posture, especially while sitting and working at a computer, is crucial. Avoiding repetitive arm movements and taking frequent breaks can help. Strengthening the muscles in the shoulders and upper back can provide support and stability. And promptly addressing any injuries or trauma to the neck or shoulder can prevent long-term problems. The prognosis for thoracic outlet syndrome varies depending on the severity of the condition and the individual's response to treatment. With conservative management, many individuals experience significant improvement in their symptoms. However, some may require surgery to achieve long-term relief. Recent research is focused on developing more accurate diagnostic tests and less invasive surgical techniques. Additionally, researchers are exploring the role of inflammation and nerve sensitization in the development of TOS.